Getting pregnant is one thing. The whole pregnancy experience up to the day of delivery is something else. 9 months is a long time, but you can be sure that at the end of the period, you'll be filled with joy of seeing and hearing the cries of your bouncing baby. In this video, we have shared the most common symptoms you're likely to experience from week 1 to your due date. Week 1. Doctors begin to calculate your due date for delivery right from week 1, which begins from the last menstrual period you have before you are confirmed pregnant. This could also mean you're open to experiencing your usual menstrual symptoms, including blood flow, cramps, mood swings, sore breasts, and others. Week 2. Ovulation begins. During ovulation, you may experience twingling lower abdominal pain, breast tenderness, slippery discharge that resembles egg whites, and an increased basal body temperature. You have to pay close attention to your physical signs. Week 3. You may likely experience mild abdominal cramps or implantation bleeding. Call your doctor immediately if you're bleeding heavily or you feel intense pain. This could be an indication of an ectopic pregnancy, a pregnancy in which fertilized eggs implant outside the uterus. Week 4. In week 4, even tests you do at home with pregnancy kits can come back positive. Congratulations! One of the earliest symptoms you will experience is breast tenderness. You may likely experience a heightened sense of smell or taste, mood swings, fatigue, constipation, and bloating. Don't be scared or worried. They won't all come at once and may even take longer to begin. Week 5. In week 5, you're likely to be in your feelings. You will experience hormone-induced mood swings. Your emotions may change from depressed to angry to happy without reason or cause. Aside from the breast tenderness, you may easily feel fatigued or nauseous. Week 6. No one looks forward to week 6 as it comes with morning sickness. Although in some cases it may begin later on or not at all, you may sometimes feel queasy and will have food cravings and aversions. You may experience the morning sickness until the second trimester, a period of 3 months. Till then, you're advised to find ways to cope. Eat smaller meals, eat ginger, and generally avoid any triggering foods. Week 7. You begin urinating frequently. Reason being, your body has increased fluids, your kidneys work harder to eliminate waste, and your growing uterus compresses your bladder. Be self-aware and plan for bathroom breaks. Week 8. In week 8, you're likely to experience all pregnancy symptoms in full swing: nausea, breast tenderness, frequent urination, fatigue, bloating, mood swings, and others like extra saliva in your mouth, some of which may last till the end of the first trimester. Due to hormonal surges, you may sometimes experience headaches. Week 9. You will have to talk to your doctor about diet or even stool softeners, as your digestive system will slow down due to the growing of your baby, which also affects the motility of your intestines, leading them to move slowly than usual. You may also experience constipation and excess gas along with the nausea feeling and morning sickness. Week 10. You begin to glow. You experience the pregnancy glow along with the common hormone-induced acne. Your breasts and belly get bigger each week. Week 11. You may feel your baby kick in your stomach, which will cause aches and cramps around your abdomen. Your body will begin to clear bacteria and you'll notice a creamy discharge known as leukorrhea in your underwear. This is normal during pregnancy. Week 12. Your blood volume increases by around 50% and you begin to notice veins on your skin. This is normal during pregnancy. Week 13. The end of the first trimester will come with a number of symptoms going away. In week 13, you begin to feel dizzy more often due to reduced blood flow and lower blood pressure. Do well to stay hydrated and change positions slowly while laying down. Week 14. You're now in the second trimester, which is known as the easiest trimester. You likely have an increased appetite, energy, and even a higher sex drive. Make good use of the feel-good trimester by starting an exercise routine as recommended by your doctor and prepare your house for the baby you're expecting. Week 15. Your nose becomes stuffy, your legs feel cramped, your gums become sensitive, and you begin to feel clumsy at this stage of the pregnancy. Week 16. It has been proven that 90% of pregnant people at this stage experience darkening of skin around the nipples, inner thighs, armpits, and navel, which could sometimes extend to the cheeks and nose. Week 17. You'll feel backaches more often and may be sometimes more forgetful. Your baby may begin to kick more rapidly in the coming weeks. Week 18. Your belly becomes bigger. Your breasts get bigger. You begin to gain weight. Your foot size may even change and your feet gets bigger. Week 19. You should begin to eat smaller meals as you would likely experience heartburns. More importantly, avoid eating anything acidic, greasy, or spicy. The constipation may continue as your baby grows bigger, pressing against your intestines. Week 20. By now, the kicking may have increased. Also common at this stage will be leg cramps, dry eyes, and trouble sleeping. You should try using a pregnancy pillow for better night rest. Week 21. As your baby grows, pains in your hip, groin, abdomen may increase as they stretch to accommodate your growing baby. Week 22. Your hair becomes thicker and shinier and your nails grow faster, a result of your body storing extra nutrients. The skin on your stomach may be dry and irritated as it's constantly being stretched. Week 23. During this time, you will likely continue to deal with leg cramps, brain fog, backaches, increased vaginal discharge, headaches, constipation, stretch marks, and other symptoms. Week 24. At this stage, you may either still experience high sex drive or a dwindling libido. Your gums may begin to bleed or you may feel tingling hands. Weight gain as well as snoring from nasal hypertrophy. 25. The numbness you feel in your hands will go away after you give birth. Avoid sleeping on your hands, and as part of your routine, try shaking your wrists throughout the day. Week 26. You may find it difficult to sleep due to anxiety, leg cramps, frequent urination, or general discomfort. Your hands and feet may feel itchy. You can apply lotions, ointment to stop the itching, but if it becomes intense, you have to go see the doctor. You'll need medical care. Week 27. At this stage, along with the backaches and leg cramps, you may notice itchy, swollen veins pop up due to the increased blood flow and pressure. Add high fiber foods to your diet and plenty intake of fluids. Week 28. The third trimester begins. You begin to feel physically exhausted and generally uncomfortable. Aches and pains are common. Your blood pressure begins to rise. Your body preparing for breastfeeding. Yellowish colostrum leaks from your breasts, a precursor to mature breast milk. Week 30. All your symptoms like itching, swelling, aching, heartburns, and others may likely become more pronounced. Hopefully with time, they'll fade. Week 31. Some people may have experienced the symptoms through all the trimesters, but others experience a break in the second trimester. At this stage, all symptoms or some may have a comeback. Week 32. Your body may begin to practice contractions called Braxton Hicks. They'll happen more often as the pregnancy progresses. They should last for no more than 2 minutes. Week 33. Your baby is getting bigger and pressing against your internal organs. Your bladder becomes more loose. You'll experience shortness of breath, heartburn, and general discomfort. Week 34. You're getting closer to delivery, but keep in mind, every day counts in the development of your baby. You may feel the intensity in movement as your baby grows and gets into position for birth. Contact your doctor if you have any concerns. Week 35. As labor approaches, you'll notice more Braxton Hicks. You should learn to know the difference between these practice pains from the actual contractions. Week 36. You can feel the movement. You're about 2 to 4 weeks before delivery. Your baby will begin dropping to your lower pelvis, which will release pressure from your internal organs, allowing you to breathe easier. Week 37. Your pelvis will become uncomfortable and you will experience abdominal pain. Call your doctor if you're bleeding like on a period, as you may need medical attention. Week 38. At this stage, you lose the mucus that blocks the opening of the cervix to protect your baby from germs. It will look like a thick pink or blood-tinged discharge a few days or weeks before labor, week 39. If your water breaks, you may notice a gush or flow of fluid. You may experience early signs of labor, which could sometimes last for hours. Your provider will have a recommendation for you to practice in this period. Week 40. At this stage, you need an ultrasound to monitor the baby's position, size, and fluid levels to ensure all is going well. Week 41. If your baby passed week 40, it is now overdue the due date. Hang in there, your baby will be in your arms soon. Consider using movement like walking, squatting, or even dancing to improve your chances of going into labor. Week 42. Most babies are born within 2 weeks of their due date. Before or after, it's uncommon to reach week 42. But if you do, continue to take care of yourself, and before you know it, your baby will be in your arms. We recommend you use this list week by week to prepare and journey through your pregnancy period. You should also bear in mind that pregnancy can be unpredictable. It's always best to pay close attention to your body, stay on a diet, and always reach out to your doctor if you have questions or concerns about your symptoms. Don't forget to subscribe, like, and turn on your notification bell to find out when a new video arrives. Till next time, bye for now.